I'm Thomas Pope. I am the clinical director and the co-founder of the LOMI Psychotherapy Clinic. And we opened the clinic in 1987, so 33 years ago. And and I'm, as a clinical director, I'm involved in supervision and training and hiring and basically managing the clinic in many different ways. LOMI School started in 1970 as an integration of mind, body, and spirit, long before it was really popular. We opened the clinic in 1987 for graduate students and interns and licensed people to work with a sliding scale population in Sonoma County. Both that was needed, as well as interns were looking for places to be able to work to practice in a way that was our specialty, which is the mindfulness-based somatic approach that we have, integrating psychodynamics, cognitive behavioral, and many other therapies. But our main focus has been from the beginning years of the mindfulness-based somatic approach, and that is integrated into our supervision and training programs and work. The site, we see a wide range of people, from children to adults individually, as well as couples and families and groups. And we serve a lot of people that don't have other access to therapy. And so we deal with issues of poverty and social justice issues, as well as people with major mental health issues, a lot of stress-related adjustment problems. And in the latter years in Sonoma County, we have worked a lot with people who are fire survivors directly or indirectly. And so our work with depression, anxiety, and trauma is a big focus of our clinic. A trainee is going to come into our program and be an individual and group supervision, and is responsible for coming to the training classes. We have 3 hours of training each week. And besides seeing the clients, becoming proficient in documentation is one of the training aspects that people learn. And when we are on site, we all participate in keeping our building. We have cleaners, of course, but keeping our clinic running on a practical level, making sure it's straight and neat. And we also have several events every year that we ask all of our staff to be involved with, from the human race to an online auction, so that we can raise money to stay open. And so we ask everyone to put a little time and effort into helping outreach and fundraising in that way. The main part is seeing clients, being responsible for them, and for attending the trainings and the supervision in an open way. Clients call on the telephone when they are wanting to seek therapy, and we have an intake coordinator who screens people and knows our staff. So we do refer people that need services beyond the scope of what we can do, that are in severe crisis or with addiction or psychosis. But being a sliding scale clinic in our community, a community counseling clinic, there are not a lot of places for people to go other than a few of us clinics in Sonoma County. So our intake coordinator knows our staff and will see who is the most appropriate therapist for the client, and to make sure that a trainee is not being assigned a client that might be beyond what he or she they should actually take on in their level of training. Our most the majority of our clients are individuals, whether they're adults or children, but we do have couples and families also. And some people are very interested in creating groups, and that is not expected of our trainees, but we welcome that. And the typical client load is to work up to having 10 clients. And we do know that trainees are new in the field, and so we don't want to overburden anyone. We want to make sure that people that are extremely complicated perhaps are not assigned to a trainee. Sometimes that does happen because we can't screen for everything in a phone interview. But we don't want people to suddenly have 10 clients, especially if they've hardly worked very much in the field. So we want people to slowly build up to carrying a full caseload. And it might be that people are working, the trainees are working with clients who are just having trouble with anxiety or stress, and then maybe a few that have a higher acuity. But it's to work up toward having 10 clients per week. Both individual and group supervision. And most people are assigned based on, sometimes it's just based on the time that's possible. We have 4 different groups, and everyone is in a group supervision weekly and individual. So how is it structured? Well, we want to address the needs of each practicum student. And in individual supervision, they might get a little more of the nuts and bolts of how do you begin a session and how do you start documenting the work. But we also want to help the trainees, the supervisees, learn to think clinically about each case. So just as the trainee is learning to address the needs of the client, we want our supervisors to really assess where this person needs structure and where they need more just open inquiry about the client. Sometimes the supervisor educates about the specific clients, and sometimes it's more of inquiring of what the trainee is learning and seeing, and helping them organize it and deal with the countertransference that comes up, as well as to help learn to frame issues for the client in a way that helps them address their underlying issues. The group supervision is really great in that each participant learns about a lot of different cases, from hearing about them from the other therapists. We have usually 5 or 6 people in a group, and they learn a lot of different ways of approaching similar issues also, because there will be 5 or 6 interns in a group, whether they're practicum or associates or pre-doctoral or postdoctoral or licensed, as well as the supervisor, having different approaches. So we like a collaborative approach in the group supervision and everyone to be involved. It's not just individual supervision in a group setting. So we have two different training classes for people in their first year at the LOMI clinic. So there's a 1-hour weekly training that I'm the one that leads that mostly. And we use that training to both, starting in the fall, we begin with the overview of our field. How do you begin a therapeutic relationship? What is the therapeutic frame? How do you build rapport? And then how do we address the documentation needs that our field and our clinic requires? And so there's a training in the basics of the profession for 1 quarter. And then the other 3 quarters focus on the overview of our mindfulness-based somatic approach, especially on how to use mindfulness in a clinical setting, and then how to work with the interpersonal or contact or the attachment piece in an embodied way, from everything from how do you tolerate being close or present with a client, how do you create boundaries in experiential ways, issues like that. How do you address rupture issues that come up and create a repair situation, whether it's the client dealing with that or whether it's the therapist and the client dealing with that. And then we move on to our work with energy, emotion, affect, and trauma in the latter period of the year. So that's an overview of our approach. And then in the afternoon training on Fridays is a 2-hour training. And we go further into some of what I just talked about in more depth. But we also have a wide range of training topics that we cover, selected topics from everything from working with LGBT, working with other cross-cultural issues, diversity issues, specific diagnoses like bipolar, depression, trauma is a big subject, grief, many different subjects we bring up, working with couples and families and children. We cover a lot of different things in the year or in several years. I see a training approach over several years, and sometimes people stay longer and get the whole thing. Trainees almost always have a lot of anxiety about beginning work with their clients. So I think if trainees are successful in knowing how to manage anxiety and stay present and not to be judgmental of themselves for having anxiety, that really does help. And having practices that really help work with that, from meditation or exercise or yoga, those can be helpful, as well as we really like everyone to go to therapy also, and we find that really helps. Attitudinally, I think it really helps if trainees and other therapists develop an attitude of being open and being curious and kind and suspending judgment as much as possible. Of course, we have judgment, but learning not to be swept away with it really does help. And practicing openness, curiosity, kindness, and a ability to learn to inquire without having to be the expert. We really believe in what Suzuki Roshi talked about developing Zen mind or beginner's mind, and bringing that into the room with the client is extremely helpful and takes the pressure off of having to know everything. Being okay with not knowing and having that beginner's mind that's an asset and not a deficit. Those are some of the attitudinal things that I think really help people be successful with their clients and in our program. We all get clients that challenge us, and sometimes there can be clients that are really too challenging for anyone almost, or too challenging especially for a trainee. And so that does happen sometimes and causes anxiety and sometimes thinking about them in the night. But I would say that doesn't happen that much at our clinic. And we try to support people in learning from those situations, of course. Um, I would say that learning the language and skill of documenting our work is a major challenge for many people. And I think that is something that people talk about a lot, that they feel burdened by that aspect of our field, which is really important to learn to master. And that's why we spend time in the fall on addressing some of those issues so that people can learn the skill and can write in ways that they don't have to reinvent the wheel all the time, and learn to use basic language and not try to write with psychological jargon that can cause problems down the line. So I think that's a big challenge. Trainees, I would say, because they're still in school and taking classes, as well as having a placement like the LOMI clinic, all of that can be a big challenge, and people feel stressed with time, feel stressed, period, don't have time sometimes for enough self-care. And I think that's probably true for trainees in all programs, but I do see that in ours also. I think we love getting CIS practicum students and graduates because they seem to have a base of understanding to bring to our clinic. And I think that our mindfulness-based somatic approach fits in with the different programs there at CIAS. And I think that we're a good fit in that way. What I think is, I like to stress that we want each new therapist, learning therapist, to become the best therapist that they can be. And we want to stress on building on the trainees' strengths that they bring, the knowledge, life experience that they have, and not to become a cookie cutter LOMI therapist or Thomas Pope therapist or whoever their supervisor is. We want each person to develop their own skills in the container of offering ethical therapy within our clinic. And so I like to stress that we want you as a trainee to blossom into the best therapist you can be, which will be different from the person sitting next to them. And we really, even though they might be doing the same type of therapy, everyone has their own assets and strengths that they bring. And we want to both accentuate those and then help each person address the challenges that every therapist has, especially in the beginning, and to deal with the countertransference, the anxieties that do come up when we're working with clients. So we want to both build on the resources each person has and address the specific challenges that every therapist faces in our field. So, and we don't want just cookie cutter therapists that. So in our supervision and training, we don't want to tell you, this is what you do and this is how you do that. Yes, we want our supervisors and trainees to offer their expertise, but we want each therapist to learn to integrate that in a way that works for them.